Hello, this is a empty nose syndrome survival kit. Everybody has different things that help them and that they use and different symptoms. For me, my right side is missing most of the volume. My left side is damaged. I can't feel the sensation through this side of my nose and barely through this side. This side also gets clogged. This eye gets a little puffier here. It's not too bad, but if you look at the difference, this one's kind of, you can see all the veins, but this side, there we go, swells a little bit more. It's not too bad today, but I've been fighting the lymph nodes getting a little bit bigger. The back of my throat, I feel like I'm constantly fighting infections in this side. So I've already kind of started. Took a nice Epsom salt bath and lubed my body up with some argan oil. I put on a little bit of this. This is a 1-to-1 formula hydrating lotion, and it's great because you can use it on your face. It has less THC. It's really smooth. I'm gonna lie back because kind of just easier. So I rub it around my sinuses and my nose, and I bring it down to the neck, the limbs, make sure gently, a little bit behind the ears, being gentle with the ears. And then if I can get it open right now on camera, I normally use just the menthol, the topical, but this is the Boom Boom stick. It's the menthol or the mint flavor. I don't put it all the way up my nose or in my nose because I don't want to. I just want a little bit of the scent. And I don't want to worry about any rebound dryness or inflammation, anything like that. So this is going to be the next guy. It's Nose Aid. I clean the tip every time I use it with alcohol, and if I notice I'm having green or weird mucus colors or a lot of white mucus, I'll skip going up my nose. Luckily, it started kind of clearing up a little bit today, or at least not getting worse, which is good. So I'm gonna put my head back. I prime it a little bit before I squirt it. And then this one's running low, so normally I would just need one squirt, but because this one's almost out, it's not squirting the same volume. So this is a face massager. There's a heat option. It doesn't get very hot, it's just more like a light warm, or you can make it cold. And it's really gentle, just silicone. But once I spray it, I like to help spread it. And I can actually feel it nicely spreading in my sinuses, and I actually feel some moisture returning to my throat right now. And this area just feels really nice to do some really gentle circles. I'm not pushing very hard. Just some gentle circles. And I was gonna grab my biotin lozenges because they have menthol in them too. And they're good for dry mouth, but I don't have them in my little bag like I normally do, so I'm just gonna pass for right now. And when I'm in a rush, I only do this for a couple of minutes. When I'm not in a rush, it just feels really nice, really gentle, especially when I feel like things aren't moving right. Things are really either stuck, thick, phlegmy, or wide open, dry. The wide open dry is typically when it is harder to manipulate or, you know, tell my brain that there's air coming in through my nose. Because the way that I try to focus on breathing and kind of redirect my brain, which has helped me, is feeling the mucus move in the back. Since I'm not feeling it here, I can feel the movement of the mucus. So when it's very, very dry, and very, very cleared out, the breathing sensations are a little harder on my body. So I make sure to remedy that as quickly as possible. When it's super bad, I like to use warm steam with distilled water. I have a little facial steamer, and that, you know, holding it at a distance, but I also will open my mouth sometimes because my mouth gets really cold and dry inside. I like to use that. So obviously nothing's a perfect fix, but this is just something that has helped me, and every little bit helps, obviously. And there's many other things you can do, like buteyko breathing, and you know, some use nebulizers with sterile saline solution to quickly hydrate some areas in the back. Lots of stuff. This is just one that I really like, especially because it's kind of a couple birds in one stone. Got the hydrating face cream with a lower THC. Helps with some of the pain. I feel like it helps with some of the inflammation, at least a little bit. At minimum, it's not making it worse. So, and then of course the Nose Aid sesame oil to help hydrate and give some stickiness and moisture without causing rebound dryness. I did also put in some eye drops. Eye drops are a very, very regular part of my day. Make sure you get preservative free. Make sure you look at the ingredients. There's a lot of good websites from doctors that go over what they recommend best for, you know, if you have red, itchy, sore eyes, you know, basically look out for dilators and things like that, because unless your doctor tells you to, you know, there's information out there. Just be careful what you put in your eyes, what you put in your nose, what you put in your face. You know, keeping that area healthy and, you know, limiting rebound side effects or flaring something up is always going to be, you know, a priority. So I really like this thing. It was maybe 30 bucks on Amazon. It's silicone, it washes easy. It glides easy with the argan oil that I have. This is what I put all over my skin once I got out of the shower and was dried off. Yeah, So this is just what helps me. I could use this thing. Sometimes I'll just use it for 30 minutes because it feels so nice and relaxing. And it's just very gentle. This is the brand Nagra Kula. Oh, it's gonna be hard to see. This is not professional lighting. But anyways, there it is. I sometimes also will just hold it here. Get some specific areas that feel like they don't have a lot of blood flow. Something's wonky. So this is something that you can play around with, but at minimum, I always try to spread the oil out in my face. Try to do some lymph node draining type stuff. And as always with lymph node stuff, make sure you open up, at least work on some of the other lower major lymph areas too. I like to get my chest, my arm, my neck, and then I do a little bit of the lower ones too. But it's all a work in progress constantly. And this is just something that has helped me. So I hope it helps you.